Good evening. I'm Alan Martin.
And I'm Elizabeth Cook. COVID cases in California have exploded to new heights, breaking pandemic records. This chart shows the huge spike in cases due to the Omicron-fueled surge. The state released its first COVID-19 data for the year. California is now reporting its highest ever 7-day positivity rate at more than 20%. Cruising past a previous record of 17%.
As cases skyrocket, so does the demand for testing. And there are two different types of tests, but which one should you take if you may have been exposed? KPIX5's Andria Borba here to explain. Andria?
Well, Alan and Elizabeth, of course, there are the rapid tests that you administer yourself at home and those PCR tests that are handled by a lab. But doctors say at this point in the pandemic, there's really only one kind of test you need if you don't want to infect anyone else. The line to get tested for COVID-19 is wrapping around the corner of 2nd and King Streets in San Francisco. For some, like Giuliano and Renata Correa, it doesn't matter what kind of test they get, they just need a test.
Returning to Brazil tomorrow, and we must be tested before going back.
With both rapid and PCR tests scarce during this post-holiday Omicron surge, what do you need? Which should you get? Dr. Michael Mina is the Chief Science Officer for eMed.
The appropriate tool in this pandemic to answer the question, do I need to isolate? Am I infectious and a risk to my neighbors? Is using a rapid antigen test because it only stays positive as long as you are infectious.
The rapid tests only detect when you are infectious and shedding virus into the air. PCR tests are much more sensitive and can detect viral RNA for weeks after symptoms stop. Dr. George Rutherford of UCSF says this is the best use case for PCR tests.
If you are older, if you have risk factors, if you think you might be a candidate for some of the antiviral drugs that are just coming available now or for monoclonal antibodies, you will definitely need a PCR diagnosis for that because we'll want to understand whether it's Omicron or Delta, all those kinds of things.
Dr. Rutherford says there is very little concern over false positive with those rapid tests. He says if you're shedding virus, chances are it's going to pick it up. They say you can also keep using those rapid tests if you, in fact, get infected with COVID-19. Keep testing yourself and figure out when exactly you are not contagious anymore when those tests come up negative, and then you can come out of isolation. Live in San Francisco tonight, Andria Borba, KPIX5.